Hi, I'm Baylee, and tomorrow I am getting LASIK eye surgery at Diagnostic Eye Center. When I'm not wearing my glasses or contacts, I pretty much am unable to do any daily life activities. I have to put them in first thing in the morning, and it's the last thing I do before I go to bed. For LASIK, you need to have a stable prescription, which I knew mine hadn't changed in about 3 years or so. So I finally want to take the first step and start Googling some different practices that offer LASIK, and this led me to Diagnostic Eye Center. They have a ton of great reviews, and they had a really easy option to schedule a free consultation, and I did that, and they called me afterwards to confirm my appointment, and it was a really smooth process.
I'm Dr. Andres Parra. I am an ophthalmologist and refractive specialist as well as LASIK eye surgeon at Diagnostic Eye Center. I am passionate about using cutting-edge technology to provide our patients with the best possible vision that suits their needs and their lifestyle. Really, the flexibility to do the things that you want to do on your own terms is the main reason why people ultimately seek to get LASIK. The first step when it comes to deciding that you want to do LASIK is finding a surgeon that you really trust. You're going to want to book a consultation, and the consultation will be the ultimate decider of whether you are a good candidate for LASIK or not.
I arrived at Diagnostic Eye Center, and I was a little bit nervous because I didn't really know what to expect. It was a variation of a few different machines that took some different imaging of my eyes. Dr. Parra came in and he explained to me the procedure and what would happen the day of the LASIK.
Good candidate for LASIK is usually somebody from their early 20s to about early 50s. LASIK reshapes the curvature of the front of the eye to essentially treat the prescription of your glasses into the surface of your eye so you don't depend on them anymore. In Baylee's case, she certainly had some questions and anxieties about the procedure, but we were able to arrive at the conclusion that she was a perfectly good candidate with a very thick cornea that would allow for me to do the treatment to correct her vision and get her out of glasses.
So before the procedure, I had a lot of nerves, maybe even more so than most. I took my Valium to relax me before I left to go to the clinic. I was really nervous when I got there as well, but everyone made me feel really comfortable, which kind of eased the process. After I got there, I did one more screening just to check my vision one more time, and then they took me to a relaxation room, and it gave me a second to just kind of lay back, relax. I feel like that part definitely helped to calm my nerves. Dr. Parra came in, and one last time he came and explained everything that was going to occur. And so I feel like I had a pretty good idea walking into it of what to expect. They escorted me back to the room, and they laid me down, they gave me a blanket, they made sure I was comfortable first and foremost, which also helped to ease the nerves.
When she actually came into the room, she noticed that there were 2 lasers and a bed in between. We sat her down in the bed, and that pivoted over to the first laser where we created the flap. Dr.
Parra did a really good job of explaining that first he was creating the flap on my eye, and that was just kind of honestly a funny feeling. It just felt like a really tight suction. And then after they created the flaps, they moved me over to the other laser, which was going to mold the shape of my eye. And that honestly was the easiest part in my opinion. All I had to do was just look at some lights and then it was over.
I lifted the flap, treated one eye at a time with the laser, and then we were done. In Baylee's case, she sat down and she was on the bed for a total of less than 10 minutes. Once the procedure was done, we briefly checked her vision, and her vision was actually 20/25, and she was pretty shocked about that. I went over some of the post-op instructions, including going straight home, going into a dark room. I also mentioned to her that I'd be reaching out to her later that night just to check in on her, and she was aware that she had my cell phone number in case anything came up.
So immediately after, I felt kind of like a haziness over my vision. By the time we got home, it was a little bit uncomfortable. There's a little bit of irritation, almost kind of stinginess that goes with it. So I just took my other Valium, and then I went and got in bed and tried to get some rest.
Once I reached out to Baylee later that night, she actually mentioned to me that her vision had already been improving, the pain was gone, and she was really satisfied with the procedure.
I had my post-op appointment this morning with Dr. Parra, and less than 24 hours after my LASIK, I was already seeing better than 20/20, which is awesome. I would 100% recommend LASIK to people who are candidates. I've already let my friends and family know how easy my experience has been and just how honestly life-changing it can be.
I think it's normal for many people to think about LASIK and be worried or nervous about the outcomes. But people should know that it's actually a very safe procedure once you are told that you're a good candidate. So if the biggest hesitation is really making the plunge to make the appointment, don't be intimidated. We'll be happy to have a very frank discussion with you and reassure you about what the procedure will look like. At Diagnostic Eye Center, when you're a patient, you're family. Our absolute priority is giving you the best possible patient-centered experience, which means you should never feel like a number, and we'll care about every single one of your needs and questions throughout the process.
I just want to say thank you to Dr. Parra and the whole staff at Diagnostic Eye Center. This experience has truly been super easy and better than I even anticipated, and truly life-changing for me.